Hi, my name is Dr. Mitch, and there's a number of things that I talk to my patients about, and many of them deal with what they can do to stay out of my office, what they can do to stay in adjustment. And one of the main things that they can do is to sleep on a cervical pillow. Cervical pillow looks like this, has a contoured in the center. Their head goes over this so that their neck is supported. There are three reasons that I use this cervical pillow. One, I get a headache if I don't. Number two is for stability. And three, so the bones don't age. Now, when I think of stability, I think of how easily the bones move from side to side. This is a plastic model of the spine. This is the head, this is the atlas, this is the neck, and the shoulders start here. If you can see that this bone seems to move quite easily from back and forth. This hole right here is where the nerve comes out. If the bones move to the side like this, the nerves in that little area get pinched. Now, it looks like it moves easily from side to side, but it doesn't actually, because this is where the ribs and the neck is, and the ribs and everything connect here, so it doesn't really move that easily. This area and the neck up here, you can see how somebody has a straight neck. This is how they would look if they were on the cervical pillow. When they have a straight neck like this, I can take these two little bones and move them from side to side. That means it's unstable. If I put somebody on a cervical pillow like I showed you, and I say that's what their neck is supposed to look like, these bones don't move from side to side real easily. That makes them more stable. The third reason that I use the pillow is so the bones don't age. This is a bone, this is a disc or a cushion in between the bone, and this is another bone. Do you see how my finger is over this disc space right here? If I straighten out the curve, which is what most people's curves look like on their films, it looks like this. You can visually see that my finger appears to be pinched. Most people would think that if bones get close to bone right here, that they would wear down. Actually, the reverse of that happens. If bones get close to bone and they start rubbing on each other, they make more bone. And that making of more bone is called osteoarthritis, degenerative joint disease, osteophytes, bone spurs. Has all kinds of ugly names that I don't want to have any part of, and I'm sure that you don't want in your neck. But let me make a funny statement, awkward statement, absurd statement. Osteoarthritis is a good arthritis. I want you to think about that for a minute. I'm making kind of a weird statement. Osteoarthritis is a good arthritis. Now the reason that I say that, let's say that this bone right here in my leg is represented by my hand right here. And let's say for some reason, oops, I broke my bone in my leg. The broken pieces will rub together. When they do that, they produce some chemicals that tells the body, we have a broken bone. When those chemicals are produced, it makes more bone. That making of new bone to heal this broken bone is called osteoarthritis, degenerative joint disease. Has all those ugly names that I just mentioned. The point is, without osteoarthritis, I would not be able to heal a broken bone. It develops where bones aren't where they should be. Now, this picture on the wall, if you look at it, because somebody has a short leg, you can visually see that all of the bones in the picture aren't where they should be. That means that the short leg and the imbalance of the whole spine creates a situation where the chemicals are produced all throughout the whole body that are telling the body, hey, we have a broken bone. So if you have a gentleman who's, let's say, 40 years old, starts having knee troubles, he probably has those knee troubles because he's had a short leg his whole life. The chemicals inside the knee, because the bones aren't where they should be, have producing these chemicals that tells it wrongly it has a broken bone. So what it's doing is starting to produce arthritis in his knees. If he had even legs the whole time, he wouldn't have that arthritis in the knees. So if we can sleep on a pillow that has our neck in this position and not putting our neck in this position, then the osteoarthritis in the front here isn't going to develop. Another way that osteoarthritis develops is if the bones don't move. And that's kind of the basis of chiropractic. And I can almost say that the chiropractic adjustment is kind of like an anti-arthritic process. By getting in there and moving a bone that's stiff, you're telling it that you're not a broken bone. And what I mean by that, let's say that in my elbow here, let's say I put my elbow in a cast and I left it there for a year. And I took the cast off at the end of the year. You have to believe me that this elbow would never move again. Because the body was stationary in a cast for a year, the body thought it had a broken bone. So it fused the whole thing solid. But in a different hypothetical, let's say that I took that cast off this elbow once a week and I went like this and I put the cast back on. I think you can understand that at the end of the year, I'll still be able to move that elbow. That movement right there is kind of like the chiropractic adjustment. Patients come in to see me and they're stiff. Well, if they're stiff, they're producing the same chemicals that tells the body you could have a broken bone. They have bones out of place. I put those in place. So it's almost like a twofold thing. The bone is out of place and it's stiff, telling the body it has a broken bone, producing these same chemicals. Now, the curve in the neck, if I look over here, this is a perfect cervical curve in somebody's neck. You can see the young lady's necklace, the back of her head, her bottom of her jaw is here, and her eyeballs would be out here. I've drawn a line through her curve. And this curve, this line is going right through the backs of each of these bones. And from what I just showed you about the pillow, if you can visualize this, this person would be sleeping on a cervical pillow because her neck would be being supported right here. Now, what happens is, inside this circle, because she has a good cervical curve, there are no chemicals being produced that's telling the body it has a broken bone. What I see a lot of times with people that come in here into the clinic is a neck that looks like this. You can see how straight up and down this guy's curve is. You can see his teeth out here also. But his neck is very straight. Inside this circle, I explained to you that the chemicals start to be produced that's telling the body it has a broken bone. And if this is untreated by a chiropractor, getting in there and loosening up, or cervical pillow, it can start to look like this over time.